In 2014, we published a paper in Cancer Research describing a new mechanism through which the clear cell renal cell type carcinoma becomes more aggressive and metastatic. We had previously defined a biomarker in a urine of patients that was expressed in this cancer cell type, and we discovered in this second paper, this was an European Journal of Cancer the year before, and in 2014 we published the mechanism through which this protein, which is expressed in the membrane of the tumor, is able to trigger downstream mechanisms that finally derive in malignancy, invasiveness, and the worse prognostic for the patients. The finding of this potent, independent prognostic factor for this type of tumors, which are the most aggressive and most common, prompted the publication of a patent. We produced a patent before publishing, of course, and this patent is now in national phases already and very close to licensing in agreement with several companies. We are trying to validate, to valorize this patent now to find if this prognostic factor, which is clearly very strong predictor of survival of the patients, can also serve as a predictive biomarker for treatment. There is another clinical setting with this biomarker could be very relevant, and is on patients with localized tumors that get radical surgery. These patients, none of them receive any treatment after the surgery, and 30% of the patients will develop metastasis and will die from the disease. So we suggest that these 30% of people, these people that have high levels of the biomarker that correlates with survival, should be the target population for treatment, for adjuvant treatment. So we like to test if this marker could be a marker of success of the trial, meaning that if we treat all the patients, most likely we are not going to get any significant response because 70% will not develop metastasis. But if we use these 30% that have high levels of the biomarker, most likely they are going to correlate. So this is one thing we would like very much to try.